Okay, so I'm going to admit everyone. All right, good afternoon, everyone. Welcome. I'm Ryan Yomber with the Multnomah County Communications Office, and we are looking forward to chatting with you today. So, uh, before we get started, I just want to make sure everyone has a chance to ask for permission to record. I believe everyone has that ability to do it themselves. But if you need permission, just drop your request in the chat and we'll make sure that you get that. Um, and with that, I will kick us off. And this call is being recorded, and we'll post the recording online and send out the link after the briefing. We'll take questions after opening remarks. And as a courtesy, please limit yourself to one or two questions. If you don't get your question answered today, please email us at press@office@multco.us. And if you have any technical difficulties or otherwise, we are unable to answer your question, just let us know and we'll assist you. So with that, I'm going to hand it off to Chair Jessica Vega Peterson.
Thank you, Ryan. Good afternoon, everyone. Thank you so much for making time to be here for this media update today. I'm Jessica Vega Peterson, Multnomah County Chair. So today I'm really pleased to be bringing together key partners in our work to connect our community members to behavioral health and substance use disorders services as part of the law that gives people a new pathway to treatment as an alternative to our legal system. This work is part of our larger strategy to improve community health, well-being, and safety, and to ensure positive daily interactions between our citizens and law enforcement across Multnomah County. We're here to provide you with a deflection update on day 5 of this work. And we want to be here to answer some of the questions that has arisen as part of the reporting that you've been doing on this. So I will say that every single day in my work on behalf of Multnomah County, I'm seeing marked progress in our efforts to improve access to treatment and recovery services. And we all know we still have a lot of work ahead of us because of the increased demand for and a chronic shortage of our services. We know that treatment is the most effective pathway to recovery. We're dealing with a very challenging public health issue. But we really know that community members living with substance use disorders are far more likely to heal, recover, and thrive when they have access to adequate healthcare and treatment. So we are focusing on opening more treatment and recovery services as fast as we can and working our partners to do that. As Multnomah County and counties across the state stand up deflection services, we are meeting people at their most vulnerable moments and giving them the next steps that offer a path to the life that they want and deserve. This is really a new chapter in our work to connect community members with treatment options, and it's an early success in making stronger connections across our community to resources at this critical time. So we are 5 days in, we've already learned so much about this. We've learned that there are indeed community members who are eligible for deflection who otherwise would be arrested under the new law. We've seen that peer support has been a powerful tool in offering next steps. And we're glad to have Tony Benza, Executive Director of 4D here today to talk more specifically about the interventions and what they've looked like. We also have guests who are joining us from Volunteers of America who also joined with 4D this week to provide deflection outreaches. So I want to thank both folks and both organizations for being here. We know that chronic challenges in Old Town were addressed in the first few days of deflection. So the partnership that we have with PPB led to successful encounters that connected community members to treatment while addressing the pressing needs in that neighborhood. We're also seeing deflection happening across the county in East Portland, in North Portland, downtown, and some of the other hotspots where we know people need support. I want to make sure that we're acknowledging that September is National Recovery Month. And we know that stigmas across these issues are real. We know that our systems to support people need more resources, and we know that what we're building will always be designed to meet people where they are. I think deflection introduces new ways of meeting people's needs. it's allowing us to weave together many other resources at Multnomah County and within our community. I was really pleased to be part of some tours and ribbon cuttings just in the this week and next. I was able to tour the new Unity Center for Behavioral Health, 9-bed emergency substance use disorder services on Friday. Last week, we also had a celebration of New Narrative's second residential treatment center or residential treatment facility that is opening at Magnolia House. And tomorrow we're having a ribbon cutting of 4D's new recovery housing complex that includes 44 units of recovery supportive housing. So all of these pieces are an incredibly important part of the continuum and the ecosystem that we need to have as we're talking about deflection as just being one potential front door to those services, but one that we are really committed to making sure works right. We've also heard loud and clear on that front that our Coordinated Care Pathway Center is a necessary tool for our law enforcement partners to get people immediate support. And so we are working as quickly as possible to make sure that that opens as soon as possible. We are making substantial progress daily towards that opening. Just this week, the county secured a building permit and staff training is beginning on site. We expect to be able to announce a more specific timeline for the Pathway Center opening very soon. And I will say we're also hyper-focused on positive community engagement efforts to address community concern. We've committed to being good neighbors as part of this process. We've made progress on establishing a good neighbor agreement that the surrounding community is looking for. That work is ongoing, but we know that it will be critical to have that in place in the next several weeks. Multnomah County is doing what community members expect of us. We're creating an evidence-based pathway to health and recovery that holds people accountable while offering our community members hope for long-term recovery. I know that everyone involved will continue coordinating closely to assure success from here. That is a commitment that we have from all of our partners. I'm now happy to turn things over to our Multnomah County Health Department Director, Rachel Branks. She's going to provide more specific information about our deflection work, what it's looked like since September 1st. Rachel.
Thank you, Chair, and thank you everyone for being here. I want to start by acknowledging that substance use and drug addiction is complex. It's a chronic health condition that requires an evidence-based response. And we know that people need access to help and that we need to be prioritizing equitable access to care and reducing stigma. So we're building a new system. And for the health department, it's important that that approach is holistic, addresses a person's mental health and trauma, homelessness, and other social determinants. We also want to focus on prevention as much as we can, wherever we can, and intervention when needed. Our goal is to connect individuals to needed services and foster a culture of support and compassion. And we know that this approach helps people achieve long-term recovery and ultimately strengthens all of our communities. On September 1st, we successfully launched field-based deflection, and it's operating smoothly. I want to share my appreciation for everyone that's worked over this holiday weekend to support these services, and a special thanks to our contracted partners who are here today and who've been supporting deflection in the community. 4D Recovery, Volunteers of America, and our health department's PATH team. We have a total of 8 individuals that have been referred to deflection by the Portland Police Bureau at the end of day yesterday from various parts of the county. 1 individual on September 1st, 2 on September 2nd, 3 on September 3rd, and 2 yesterday, September 4th. Our PATH team is also actively supporting deflection in the courts for anyone who is arrested outside the hours of 8 a.m. and 8 p.m., as long as the district attorney finds them to be eligible for deflection. We have followed up on every referral from law enforcement 100% of the time, and even provided additional outreach between calls and outside of deflection, perhaps before deflection, providing support for those folks who are in the streets, providing care and compassion and building trust, which is essential to supporting their unique recovery journeys. We have also received the occupancy permit this week for the Coordinated Care Pathway Center, and Turk House is currently training their staff in the facility. Staff from Turk House have started dispatching mobile deflection today. And I'd like to send a sincere thanks to our behavioral health call center for stepping up and supporting dispatch so that we could launch on September 1st. Again, I want to acknowledge that addiction is a complex condition that requires community and systemic support and additional access to treatment. We're encouraged to have successfully added deflection as a tool that helps individuals outside of the criminal justice system. You know that every day where people connect to a peer and care is a day that we're all moving towards the system that we want. And with that, I'll turn it over to Jay Scroggins.
Thank you, Rachel, and thank you, Chair, for the intro to this process. I am Jay Scroggin. I am the Deputy Director of the Department of Community Justice here with the county. And I just wanted to talk to you about what deflection looks like when people go through the actual court system and wind up on supervision to us. First and foremost, the Department of Community Justice is prepared to receive these individuals, and we're ready right now. We have a long history of supervising individuals for small possession amounts of controlled substances, so this isn't new to our department. What is different, though, as people go through the court system for whatever reason that they're not eligible for deflection in the community, when they go through the court system, they are under the House Bill 4002. They are to be sentenced to a period of probation. What's different, though, is that this probation is going to be called a conditional discharge. And I'm going to talk a little bit about some of the differences between a regular probation and a conditional discharge. Most probations that the Department of Community Justice, and for that matter, most of the state of Oregon receive, are periods of time of 18 months to right around 36 months and somewhere in between there. That's most cases. This is a period of supervision with conditions that is only for 12 months. Secondly, we are committed to aligning our operational structure to the mission of deflection, meaning this is still a pathway to treatment. Right away, we're going to be referring and evaluating these individuals for treatment services and referring them to the community providers in the community that we contract with currently. Lastly, one of the differences between a conditional discharge and a regular probation is what happens when they're done with treatment. With this group, similar to the deflection efforts, we can actually, when they're done with treatment, terminate the period of conditional discharge early. And with that, it triggers the court to start the process to possibly expunge their record from their criminal record forever. How we're prepared to receive these people is by, we have a team that when the individual enters probation for a conditional discharge, we first and foremost want to make sure that we recognize them, that they are different from a regular person from the court system. We've identified geographically an office on a caseload on our east side of the river on 122nd and our downtown office to supervise these folks. So geographically, we can have those services closer to where they actually live. Lastly, these individuals who are tasked with supervising these folks are fully aware of the rules of a conditional discharge, that they are that much different than a probation, meaning get them to treatment, help them succeed in getting done with treatment, getting them off of supervision, and start that process that their case can be expunged from the record. I want to thank our Department of Community Justice team, who's been working since the passing of the bill to be ready for September 1st. That is our interim director, Truls Neal. We have a senior manager, John McVeigh, and community justice manager, Nate Roberts. I want to thank them and anyone else who's been putting this together. As of now, we have not received anyone through the court system. We're on day 5. I think the district attorney can talk a little bit more about maybe what that might look like. But for right now, we are ready, and that's basically what the system's going to look like. Thank you. Now I'll give it back to you, Ryan.
Thanks, Jay. We also have invited guests from 4D Recovery and Volunteers of America. So I'm going to ask Tony to speak just for a couple minutes about what he has seen on the ground in the first couple days.
Yeah, thanks so much. And I'm just really appreciative to be here. My name is Tony Vesna. And what I want to say right out the gate is that it is Recovery Month and also recriminalization. And some people might balk at that, but I actually look at it as a really positive thing because it's going to take a coordinated effort between public safety and healthcare and treatment organizations to get the help that they need. I'm a perfect example of that. I went through the criminal justice system, went to Volunteers of America, got a scholarship to go to school and stuff, and I changed my life and I ended up being able to run 4D recovery. And what I've seen over the last 6 months is a coordination across multiple sectors in a way I've never seen before. And the debate is not, do these people who are addicted to drugs deserve treatment? The debate and the rigor that's put towards these individuals is how do we get them the help that they need? And it's actually very inspiring. And to be down on the street and helping individuals working with public safety has been great to interact with those people who are being deflected and offer them some help. And it's been a mixed bag from the sense that some people are really motivated and ready to go, and we've been able to get them the help they need right then. But our system does lack some capacity on the treatment side. And as Jessica had said, there's services coming online, some of which are from 4002, but it's going to take time. And so I think that for me, the story here is in this moment, everybody wants people to get help. We're just figuring out how to do it. And there's going to be some hiccups along the way, but anything that you do that's monumental or, meaningful has hiccups. It's not seamless. So I just want to give props out to the county workers as well. They've been working night and weekends along with my staff, and everybody's been doing double time trying to get it right. And so I hope that's the story that we can convey to voters, is that help's coming. People do recover. They are recovering. We're just trying to meet the demand of how many people are addicted right now, and we don't have enough services in total. But the intent's there, and I think we'll be looking a lot better here, a year or two from now.
Thanks, Tony. Next up, we have Rhonda Van Zant with Volunteers of America. Rhonda, can you tell us about what you're seeing in the first day or two since you've been working on the ground?
Yes, thank you. So I'm Rhonda Van Zant. I am the program manager for our burn program here at VOA. I have 23 years of recovery, long-term recovery. And the thing is that what I've seen in the last year, especially these last few months, has been, like Tony said, community partners really working together and trying to help people change their lives, right? And so since we were asked, and I'm very honored to be a part of this deflection, mobile deflection at this point in time. And so what we've seen is we've got a call on Tuesday morning, and me and my staff was able to go out onto the field and meet up with police officers, and they were very caring and had compassion for this person that they called for this deflection, and it was just very powerful. And so me and my staff, Amy, was able to meet with this gentleman. He wanted the deflection. He was going through a tough time, but my coworker was able to share her lived experience, which she's been homeless on the street for several years before she got into long-term recovery. And being able to help this person and give him a little bit of hope that being able to connect him with these resources, whether it's detox, a shelter, medical attention, and also treatment, right? So, because we let them know, because if he didn't have OHP, and so it expired. So it's like VOA can also help with getting people into treatment that are uninsured. So we have all these different resources, and being able to give them that opportunity to give them a hand up and be able to give that little bit of hope, right? Because that's what everybody needs. It's just that moment that somebody is there to say, we see you and we can help you is the biggest thing. And the thing is that he also agreed that if he still needs help, we're there to help them through it, right? So we have their contact number, and we can continue to work with this person if they need these services or they need a ride, to continue to do all these services for them, and just give them that little piece of compassion. And another thing is that we've been building more and more resources just in these few days connecting with different community partners, TPI, different shelters, different resources, detox. We have a live map of detoxes that have open beds whenever we're in the moment. So that's a huge piece that we are able to start connecting with. So I'm just grateful to be here. I'm going to go ahead and pass it on to Pam and see if she'd like to share anything.
Thank you, Rhonda. My name is Pam Kelly, and I'm the Division Director for Treatment at Volunteers of America. And we have been working with the justice involved population in partnership with Multnomah County Department of Community Justice for the last 35 years. And so we really do have a sense about what's effective and what's not effective with folks. And I think we've learned a lot of lessons, our community providers and our state perhaps over the last 2 years with the legislative changes that occurred and provided for decriminalization. That happened very quickly, and the treatment community and our community in general was not as prepared for that legislative change as we would have liked to have been. So this is really a step forward for us in terms of the partnership that has been established with Portland Police, with the county, with POs, with the DA's office, that we really are all, and other providers, that we're all really working in partnership to be able to intervene in a much more effective way. What we know is that with this population and with severe addiction and mental health issues, what's needed is not only that outreach and support, but it helps to have that leverage and structure as well. And anyone on the street, or even not on the street, trying to get help and work their way through the maze of options, it can really be overwhelming and very, very difficult to work your way through that to find the resource that you need. So in this project, we are able to make that first vital connection. As Rhonda said, it's so important that when we interact with someone, that we're able to start establishing a relationship, and that we have other partners that are involved in that, and that we can connect them to what is available. We know this is still a work in progress. We know there's a lot of work yet to be done. We know we don't have all the resources that we need, but we're in a partnership and a community-wide effort that is really moving us forward together to be able to really make a dent and be effective with the folks that are really struggling on our streets and in our community. So again, we're very hopeful, and we're very privileged and happy to be doing this work with our partners. And, we're excited about the going forward and the results that we can achieve together as a community.
Thank you so much, Pam. And with that, we are ready to take questions. We also have Adam Gibbs with the District Attorney's Office as well to talk about court cases. So what I'm going to ask is for folks to either use the hand raise feature or to indicate in the chat whether you have a question, and I will try to call on you as soon as I see it in the order that they're received. Please state which outlet you are and who your question is for. We will start with Blair.
Hi. Yeah, just a quick question. So we have 8 people since Sunday that have been referred to deflection. I'm curious how many of those are now in recovery services and how many are still on the streets.
I can jump in and answer some of that, and then we could likely get back to you as needed with some more specifics. I mean, we've heard stories from our partners, definitely, for example, of people that were able to, just one I just heard today of an individual who was able to get in to services right away at Hooper and then continue on. I know that there's also, in addition, been to the 8 in deflection, been other individuals that we have connected to services. And I think another important thing to understand about the connection to services. There's treatment services, but there's a range of other services that we work to connect people to. We've been able to get people into shelter, as well as beginning their treatment journeys.
So far one person has gone immediately into services.
Yeah, I can, Rachel, I don't know if you're looking for more data. So there's one person that has gone through the services. I think, in terms of the timing, having the new law go into effect on the Sunday of Labor Day weekend is always a challenge because there are so many services that are closed both on Sundays and on holidays. That being said, I just really want to appreciate all of the folks from 4D and VOA who have been out doing some of the work and engagement, even with limited services. I think it's reflective of the work that happens every day. People have 30 days to complete a deflection based on what was decided for Multnomah County. So that means that it's really important that when folks are engaging with the peers, when they're being given instructions on how to access services, that there's a connection that is made with that individual, and that will stay connected with the individual through the course of the 30 days to give them the opportunity to connect with the treatment or connect with whatever services they've been referred to so that they can have a successful deflection.
Just quick follow, is there any talks of within that 30-day period partnering the outreach workers with agencies that are already, say in Old Town, like Blanchet House, like places that these people go every day to help them, be successful in the 30 days?
I can answer that if that's okay. So yeah, a couple things to understand. One is, about from our perspective, about 50% of people were able to get into some sort of service that's going to be recovery oriented right away. Sorry, I had a phone call come in. And then what's the follow-up for those people? Have they been successful? We're going to know more about that probably Friday or at the end of the day as we analyze our own data. So that's coming. We're being able to track who's going to treatment, what's happening, how do we follow up with them. I also just want to say that there's been multiple people while my team's been out on the street that we've seen either just randomly and we've engaged them, got them into treatment, who are not going to get captured in the deflection data. And then also that local PD has identified as individuals who need help they have relationships with. And then we just ended up talking to the cops, engaging with the person, then getting them into services too. So I know you're hyper focused on what number of people. It's going to take a little time to get really accurate on it, but a lot of people have been getting help already very quickly.
Yeah, that's fair. So you're saying 50% of the 8, so 4 people have been connected immediately to services?
I'm saying like right now, that would be my estimate, and I cannot give you a hard number, but that's an estimate right now. In the coming weeks, we would be able to give you more hard numbers about that, but we just did start, as the chair said, and it was over Labor Day weekend. And so the exact data is hard to track. People, sometimes they get referred to service on Tuesday, but they can't get until Thursday. And so we're figuring out how do we track that and determine how to articulate those numbers.
Okay, thank you.
Courtney.
Thank you. Yeah, it's Courtney Vaughn. I'm with the Portland Mercury. My question is twofold. Can you clarify, because the deflection center is not open quite yet, can you clarify what the county's role is in this? And then secondly, we know that when someone is sort of in the throes of addiction and they agree to maybe go to treatment, they kind of need to go pretty quickly before they change their mind or relapse. And so is there a concern that people have a lot of time to enter treatment and they may completely change course within that time?
So I will answer the first question and partially answer the second, but also want to open it up to our providers who are here to help answer that question. So thanks, Courtney. So Multnomah County, as part of the system that we have set up in Multnomah County, is really in charge of the second part of the deflection, where people are connected to whatever services and whatever resources are available. So eventually that will include the Coordinated Care Pathway Center. That is the location, where people will be taken by law enforcement. But the system was always envisioned to have field-based deflection services or field-based peer interaction, especially in based on geographic areas. So that what we're doing between now and when the center is opening is really focusing on that model now. So our county and our health department has been doing a ton of work in partnership with providers of making sure like the back end pieces are up and running so that the dispatch number is functioning, that we've got people going out, that law enforcement is clear on what the expectations would be for the system. So managing all of that piece. And Rachel, I don't know if you want to add anything to that, but that is a core piece. And then, Jay also spoke with on the DCJ side of thing that in terms of the services that they do, that will be a constant no matter whether the center is open or not.
Thank you. And then I don't know if someone can touch on the issue with the timing of, they have a long time to enter treatment, and a lot of folks might just, decide they don't want treatment anymore.
Yeah, and I think that, I'm opening up to that. We want to get people to connected to services as quickly as possible, take advantage of their willingness to do that. But Tony, Rhonda, or Pam, if you want to jump in.
I can touch on that. This so the thing is that there is that window of time, right, to be able to get somebody when they have that desire to get into services and stuff. But the thing is that us as recovery mentors are able to get a hold of that person and connect and build that relationship with them, because it's all about the relationships and being able to connect with them. And they want to be seen and they want to be heard, right? Because the thing is that it's not a lifestyle that we want, right? We want to change, but we just don't know how yet. So whenever we connect with these people and we start building those relationships, and they hear our story and we hear their story, right? It builds that relationship, and then they start seeing that hope. And then we've been able to get them into, like, taking them to the meetings, connecting them, taking them out to lunch, right? Get them a cup of coffee, and just being able to sit there and share our story so that they have somebody that they can call and talk to that isn't their drug buddies, right? Or somebody that's going to, make them well for a minute. It's like being able to find somebody and give them that hope that we can connect them with. So hopefully the ability for us as recovery mentors to be able to stay in that connection with them, getting their phone numbers and helping them with this walk through their recovery. Because it's not just, we meet with them and then it's done. It's like, we want to continue to build that relationship and connect with them.
Right. And to add to that, we operate a continuum of behavioral health services, addiction and mental health services, both outpatient and residential and recovery homes. So when we do engage with someone, even if there isn't a residential bed immediately available, we are able to begin, if they're willing, to access outpatient services at whatever level they're able to participate in those. We're able to get them housing in many cases. Sometimes that may be shelter housing, sometimes that may be temporary, but we're able to piece together a package, hopefully, of support that allows that person to begin their journey with whatever they're open to in terms of treatment, intervention, peer support, and a treatment plan that will help them move through their recovery in a systematic way. So, there is some structure and support just with that first engagement available to people.
Sure. And then I think everybody should know, it's pretty clear and been, headline news for a long time, that we have an under-resourced system, and we also have a ton of investments going in. So yes, the ideal would be we would treat it like any other potentially fatal health condition. You don't have to have a wait list when you have a heart attack, and so that's what we should be building towards. But with the peers and the dedication from a lot of the service providers, we figure out a way to try to work with people as much as we can to engage them over extended periods if needed to get them into those services. But around the motivation part, you want to capitalize on a person's motivation immediately, because addiction is a disease of the mind, and so people's decision making is limited because they have a broken limbic system that's dictating their behavior. And so when they do, get the motivation to change, you want to capitalize on it.
Thank you, Tony. Christina, do you have a question?
Yes, I do. Thank you so much. It seems like there's a few things missing in this. Deflection is not just treatment, you've mentioned, it's shelters. We're short on shelter beds, we're short on detox beds, we're short on pretty much everything that has to do with deflection, including public defenders. So right now you have drug dealers that are being released from jail or having their charges completely dismissed because you don't have public defenders. So really three essential parts of this entire program are missing altogether or an extreme shortage. You have long wait lists for these people struggling with addiction. It kind of seems like we're setting a false expectation that this is going to work when the pieces are missing. Can you respond to that?
Yeah, I'm happy to respond to that, Christina. I mean, I appreciate everything. I think you've done a great job of outlining some of the really systemic challenges in both our justice system and in our healthcare system that we have. Regardless of all those factors, the legislature decided to recriminalize personal drug possession with House Bill 4002, in addition to other things that the legislation does, and that made a change to the law starting September 1st. So what we are doing in Multnomah County and in many counties throughout the state is trying to set up systems that in the best way possible respond to people to make sure that there are alternatives so that when they do have that engagement with law enforcement, there is a pathway to health and recovery and more stability, but also accountability. So, we know that the entire state is facing a shortage of treatment beds. The entire state is facing a shortage of public defenders, but we still have to respond to the law change. So I believe that every individual who is connecting with an outreach worker is moving closer to recovery. We know that recovery doesn't happen overnight. We also know that expanding a system that has been underfunded for decades also isn't going to happen overnight, but we are building on those resources every day. And I said, we're working with our partners, we're working with our providers to take the most advantage of the system as it currently exists, as we're bringing new resources on the line.
Do you have any idea, you guys talked about the difference between outpatient medication for detox and those inpatient detox beds. The detox beds obviously are the ones in extreme shortage. I don't know how easy it is to access outpatient detox, but can you talk about how much need there is for both of those right now and whether one is more prevalent than the other in terms of need?
Rachel, I'm going to... Sorry, no, somebody wanted to go ahead and take that. I didn't know if Rachel wanted to take.
Yeah, thank you. And then also want to open it up to our providers as well who provide these services. And just to echo on the chair's last comment, I mean, we know that we don't have all the services we need here or across the state, but we have to start somewhere, and we're starting here, and every opportunity to connect with somebody is really a step towards building the system that we want, in addition to all the services. So I just really wanted to underscore that as well, that there's a group of people on this line who will continue to work and won't let the fact that we don't have everything that we need stop us from starting where we can and moving in partnership the way that we can. So I really do hope that that's the message that comes out. I think in terms of, we have needs across the system, obviously outpatient, inpatient, detox. Anecdotally, from what I've heard in the deflection conversations, and once again, you have the people here on the streets who can tell you more. Detox is one of the needs, and we're building towards those services in our coordinated care pathway center, and look forward to providing more of those. We also know that we have services that are needed just really across the continuum.
I guess maybe I didn't state that question quite clearly enough. So with the outpatient and the inpatient detoxing, is it easy to access outpatient detoxing, and which one is more prevalently needed amongst the populations that you're interacting with?
Pam, you're on mute.
Yeah, okay. Sorry. I think that both are needed, and needed sometimes for different purposes. So, with some drugs and with alcohol, it's medically a very dangerous situation for someone to try and detox without medical supervision. And so for people that are in that situation, they really do need inpatient detox. There are other people who may be able to really benefit from outpatient medication, which will assist them in detoxing from narcotics and also in maintaining a level of sobriety. But also there needs to be, that's a medical evaluation of that person's physical status to see if that's appropriate intervention for them. And then there's also other supports that need to be in place for that. So if someone was in a tent, for example, and had no other support going on, that would be unlikely that an MD or a nurse practitioner would want to prescribe medication in that situation. So a part of the challenge that we have at this point, given where we're at in this project without the sobering center basically being established and up and running yet, is to be able to try and put that support together for those people that really are appropriate for medical support and medication on an outpatient basis. So that's, hopefully what we'll be trying to do, because with mentors, with some level of involvement in outpatient, and then with your medical provider, you can put a package together for that person that will really aid them in their recovery.
Yeah, and on top of that, this is Rhonda Van Zandt. What I have learned, what they have developed since I've been working the last 6 months, is that during the 90-day fentanyl crisis line, there is a program that was developed to have live detox beds available in the moment. And so when we're out on the street, we can pull up that map and find out who has detox beds open and being able to get people into that in the moment. So usually they fill up closer towards the end of the week, but then it's like you never know when there's going to be an opening bed. And so there's like Recovery Works Northwest, there's Hooper, Fora. There's a few different detox agencies that are able to help support us too. And that's what I mean by building these community partners and working together to find these resources for these people in the moment.
Thanks, folks. And I appreciate all the reporters who are sticking around to have their questions answered. And I'll move it on to Noelle. Noelle, do you still have a question?
Yeah, I'm wondering if there were people who agreed to deflection, but they weren't able to be served because of the lack of space you're discussing, either in shelter, withdrawal management, or treatment. And can you be specific how many people were not able to be served because there weren't spaces available for them? And secondly, what's the latest timeline for opening the center in Southeast Portland?
So I'll take that second one. So we're going to have more information available now that we have the building occupancy permit and are able to be in the building and have the training started there. So we'll have an updated timeline for you very shortly, but right now we're still planning that it would be about mid-October or mid to late October. And then for the first one, in terms of the numbers of people who weren't able to, I don't have that number. I don't know if Rachel or if someone else might have the number in terms of those who were not being able to be served that were eligible for deflection. And no, I want to make sure I have your question right. It was that they were deflected and they were engaged with a peer, but they weren't able to access the service.
That's right. Yeah, because maybe there wasn't a bed available at that hour, or there wasn't an emergency shelter bed for them at that time.
Yeah, so I don't know that, I know that there was, for instance, one person who was deflected by law enforcement, engaged with a peer, had a referral then to a service and had for instance, their dog with them, and so they weren't able to take advantage of that service right away because they were concerned about what would happen with their pet. So they were going to make arrangements with that pet and then follow up with services. And again, like having that continued connection with that person and follow up with that person is going to be a key, I think, to the success of that person. I don't know if anyone else on the call, I know Tony had to jump off. I don't know if anybody else on the call has any other numbers around that.
I just want to point out that 4D has some numbers from their direct outreach that still need to be verified, as well as VOA. So some of this is pending. So Noel, why don't we get you a more precise answer after we've verified all the outcomes in the past 48 hours?
Thank you. And one more question. Chair, was everyone who was eligible for deflection, did everyone eligible opt for deflection, or were there people who were eligible who declined?
That I believe. So I haven't heard that there were people who were eligible that didn't take up on that. I think that might be a question that we will have to check with law enforcement on their side as well, to find out if that. And I see Adam has.
I can take that.
Yeah, thank you, Adam.
So we've had 14 cases come through to the district attorney's office, which means that for one reason or another, the person was either not eligible or declined deflection. I've personally reviewed most, but not all of those. And I can say that there was, from those, one individual who expressly declined deflection, according to the police report, once given the full description of the options. And there was one individual who expressed an intense interest in deflection, but it was after hours and services were unavailable, so they were booked in lieu. And the others fell in different categories. But in terms of specifically the people who wanted deflection and was not available or declined deflection, one of each out of 14.
And Adam, can you say where those individual, were they booked and released?
No. See if I have that. One of them, after he declined deflection, they discovered he had warrants, so he wouldn't have been ultimately eligible for deflection in any event, so he was booked and held on those warrants. The other one I don't have at my fingertips. It was a case I reviewed yesterday. I don't remember if he was released or held for arraignment.
Thank you.
Next up, Lisa, unless Noel, did you have any other questions?
That's okay. I'll let someone else go.
Okay.
I've never heard of her.
Yeah, hi, thanks. Lisa Bailey from Coin. I guess it gets to the fact that there's 8 people who were initially offered deflection. And if in some of these cases there wasn't immediate treatment available, I think as Tony had mentioned, lack of capacity on the treatment side when he was, presenting. Where do we go with this? I mean, 8 people or a handful of people seems very small, and we can't even help those people to access treatment at the moment that they're ready to go in. So what's happening in terms of moving that forward? Because it seems like the program really can't be very successful if the people can't access treatment when they're ready. It's not like, oh, come back, next week, the following week, make an appointment. Obviously, these folks are not in a position to really be successful with that type of appointment, as opposed to being able to get that treatment and access right then and there. Is there anything being done in the next couple of months to really open up more treatment for people?
I can speak to that. So a couple of things. One is, I think it's important to remember that treatment and recovery is a journey, and there are many steps for people in that. Some of, as mentioned by VOA, includes and is best for a treatment bed, but there are other services. I think another thing to keep in mind, and this is to your question about what's being done, we are continuing to work with people through peers throughout 30 days and beyond. And so whether that's through follow-up calls, as was discussed, lunch, connections, those sort of things, the deflection criteria does have a 30-day window, and we continue to be working with people in that 30-day window. It's obviously very early on in terms of 5 days. But we and the peers and the behavioral health professionals are doing everything that they can to continue to connect people to take steps in that journey. there are other services that people may need in addition to treatment. And so, as mentioned, a care plan is developed that could include health services, that could include getting someone on Oregon Health Plan, that could include a variety of different things. So I just want to make sure to paint a picture that the services that deflection offers are broad, and ultimately we do want people to get into recovery, but there are many steps on that process, and there are many other ways that we're serving people and their needs in the moment.
Lastly, can I ask Rhonda or Pam to describe what happens when you encounter somebody in the field and a treatment bed is not immediately available? How do you maintain that connection?
So what we do is that if there's nothing available in the moment and stuff, we make sure that we have their contact number. If they only have a Wi-Fi phone or whatever, we ask where they usually are at, right? So if we can't get them into shelter or something like that, it's like, then we can go meet them on that corner, right? Or we can meet them at McDonald's or someplace, so that we can start building those relationships and start connecting with them. And we usually try to say, okay, so we'll be over here at such and such time so that we can connect with them. And if they don't have a phone or something, we'll go and we'll try to get them a phone so that they can have these phone calls and make these connections so that they have these services. So it's more than just getting them in there. It's like being able to keep in that connection and building those relationships so that they see that there's somebody who's going to be there to help them.
Thank you, Rhonda. And we are coming close to time. So after 2:30, we'll have to answer any follow-up questions via press office. Ben.
Thanks. So when the new center opens, will that be a 24-hour, 7-day-a-week center? And if not, what are the hours? Thanks.
Yeah, so I can take this and then Rachel, if you want to add any more details. So the ultimate goal is to have a 24/7 pathway center set up. I think what we also want to do is, as we are going through bringing staff online, and as Turk House is working to get those trained, we want to make sure like we are opening at the way we can and being available in the ways we can as we build up to 24/7. So I think that's the conversation right now, is what does it look like in terms of our staffing, in terms of the capacity of bringing the resource online as soon as we can, but knowing that might be not be at the 24/7 initially, but ultimately the goal is 24/7. And Rachel, please go ahead and dive in if there was anything else.
Ben, do you have any other questions?
Oh, and what's the cost, and does that cost come from county funding or what the legislature approved?
Oh, go ahead.
Oh, sorry. Ben, I can send you those numbers immediately after this.
Thanks.
Noelle, I'm not sure if you still have a question or if you just didn't have a chance to lower your hand.
Oh, sorry.
And Ryan, I've got to jump to my next meeting, so we're
right.
a little bit over time, I think, for this one, but I think everybody had a chance to at least ask one question.
I do have a quick follow-up if we have till 2:30.
So it sounds like the chair needs to head to a meeting, but do you want to can you pitch your question to me and we can follow up?
Sure. Yeah. I mean, the question is, I've asked this before, why the need for the deflection center specifically? It sounds like a lot of the things that you would refer someone to from a deflection center itself are still not there. We're not going to have the sobering center in time for the October opening. We don't have enough shelter beds. We don't have enough detox beds. Already with these mobile teams, we're referring people to services that are not there. So what's going to happen when you have a actual center? Where are you taking these people afterwards? You're taking them back to the tent that they were already sleeping in. So what's the point of taking them to a center and then back to their tent?
So I think for that one, we'll point you to the chair's prior statements answering that particular question, and I'll make sure that you get that answer again from her. Her
I mean, the
position,
statement was that that's what law enforcement wanted, but still unclear like how that would help.
that at this time, the chair hasn't changed her stance based on the statements she's previously made. And we'll follow up with you if you have any further questions on that.
So the statement is just that that's what law enforcement wanted.
Again, I would just refer you to the chair's prior remarks on the need for a deflection center.
All right, thanks.
Thanks, folks. Again, any questions, follow up with press office at moltco.us. And thank you for your time.